Ladies and gentlemen, it is a privilege for me to be here to address this distinguished gathering. My topic today is to do with equity in healthcare delivery from theory to practice. What do I mean by that? First, theory, and then in practice. In between, I'm going to talk about the reality. Where are we? And I will talk about a model, humbly, about a model, about the Aswan Heart Center, which can act as a model for healthcare delivery. Now, what do we mean by equity in healthcare delivery? And there's a very good definition by the WHO about health disparities and about health equity. Please look at that and ponder over it. It's very important because equity is essential. There are excellent books on the subject, and I recommend that to you. One is We Are All the Same. This was actually the title of a book by Jim Wotton about a child in South Africa who was born with HIV, infected during birth, and he made his life worthwhile by lecturing around the world. He knew he was going to die at the age of 11, and he was lecturing about we are all the same. A much more recent book, which I recommend to you, is the book entitled What We Owe Each Other. That book is published this year by a lady who used to be the Deputy Governor of the Bank of England, and now she is the Vice Chancellor of London School of Economics. And Lady Manouche, knighted by the Queen for her role in the Bank of England. She talks about what we owe each other. I recommend that book to you because it tells you about the relationship between the individual and society. Importantly, the society. And that introduces the subject. Now, what's the evidence that we are all the same? Plenty of evidence. One of them is simply the Human Genome Project. It shows that we all have the same genes. We are individuals, of course, but that is different. We are all the same. We have the same genome. And then there's more evidence, and there are in the theory, as I mentioned before, from the United Nations, the SDGs. First comes the Millennium Goals. Unfortunately, the Millennium Goals, as shown on this slide, did not work. More recently, the SDGs, the Sustainable Development Goals, are being applied, and I recommend that to you because it does talk about equity. Recently, only in the last few years, there has been a big talk about vaccination against COVID-19. Equity. It didn't work. There was no vaccination. As you can see in this slide, published in one of the Arab magazine, their vaccine is not there. Now, in reality, you can see that the burden of disease, several million people die every year of heart disease. 75%, 3 out of 4, occur in the middle and low-income countries. Is that acceptable? 75%. And a lot of them are children. And there are massive inequalities when that continues. For example, you see the childhood mortality per year is 50-fold higher in Guinea-Bissau as compared to Singapore. Is that acceptable? Obviously not. Nobody can accept that. That begs the question, what do we do about it? And that takes me to the second part of my talk. Who cares? Obviously, all of us have to care. Who acts? And these are the stakeholders. Who are the stakeholders? I've listed them on this slide. Time will not allow me to read them, but please read them carefully. And the next is, who pays? And it's very easy to say governments should do that. But governments have a lot of priorities. And therefore, there is a massive role for NGOs as well as professionals, particularly who see the misery and the disease firsthand. And they have to work with governments, with other stakeholders. And who pays? You should not expect the government to pay everything. It's unrealistic. They have many, many priorities. Then you have to, all the stakeholders can join forces to pay together. And that can work. Does it really work? I will just end up my talk by saying, yes, it does. And we have an example in the Aswan Heart Center, a humble, I repeat, humble organization, but it tries very hard to achieve these goals. And the goals are an integrated healthcare delivery without discrimination, regardless of color, religion, who you are, money, anything. We never in Aswan give anybody a bill, never. It's all free at entry. But at the very highest level, and to achieve that, there is massive training and massive research as well. So that is a model. Who pays? It's all the stakeholders. And the stakeholders are varied, particularly the people, the population who own the program, and they pay small payments which amount to a whole lot. But everybody else contributes. And people from this country actually contribute significantly. But the research and the training are integrated, are part of the whole venture. This is Aswan, and it's beautiful, as you can see. And this is the research center next to, inside the hospital. And the need is tremendous, as you can see here. The suffering on the face of the child, but look at the anxiety of the father and the family. So you're treating a whole community, and that's essential. The cost, and these are the number of surgeries are going up and up and up. Now the center performs over 1,000 open heart operations, 3,000 interventions, 24,000 outpatients, and importantly, discovering new operations, essentially to increase the applicability of these operations. Like you see here, it is a very complex inborn congenital heart disease. But in the Aswan Heart Center, we modified it and performed over 1,000 operations in this condition. And now it can be performed efficiently in any center. The same applies to common arterial trunk. Don't mind the complexity of the slide, but it shows you can perform a very complex, correct a complex condition in infancy, in the first weeks of life, without resorting to very expensive conduits or applications which you depend on importing. So everybody around the world can perform this operation, which is even superior to the operations which are being performed in rich countries. And this just showing the outpatient visits going up and up and up to several thousands. And cost effectiveness is essential. The operations in Aswan cost 10% of what, all told, of what they would cost in the UK or the US. That doesn't end there, because knowledge dissemination is important. So we train people, and the research is either clinical, molecular, biomedical, or population science. Population science is dedicated building in a village near Aswan, the Balana Heart Study, which looks after these people for 20 years to see what affects them and how can it be prevented. And so what are the conclusions? The conclusions are the theory of equity in healthcare delivery is very well developed, as I have shown you. However, major inequalities persist and require concerted action immediately. We cannot wait any longer, because children, adults are dying every day. If there are a way out of this, I have presented to you a unifying, sustainable is very important, because no good just having something which lasts a year or two. You must train people to continue this effort forever after. There is no forever, but as long as it can be required. I have presented to you a model, a humble model, I have to say, but it's effective and can deal with this dreadful inequality. Thank you very much.
Thank you, Professor Magdi. As you'll see, Professor Magdi has taken a seat. He's not done. We're not done with him just yet. We're going to continue this conversation. And to do that, I would like to introduce the moderator for this segment, Caroline Farage, Vice President of CNN.
Well, thank you very much for this presentation, and thank you for making it simple for us who are not doctors to understand it. So thank you very much for that. Let me start in this chat today. We are going to shed the light on your story, how you became Sir Magdi Yacoub. So let's take you back when you decided to become a doctor. Who influenced you to become a doctor? Was it your parents, or it was your decision, Professor?
It was entirely my decision. As I remember, as a child, my dad was a doctor, and I had him as a role model. I wanted to be a doctor. Mm-hmm. I wanted also to be a heart doctor, because my aunt died at the age of 20 during childbirth from a narrow heart valve. So I said to my dad, I'm going to be a heart doctor, a heart surgeon. And I was a mere 5-year-old. He said, impossible. You haven't got it in you to do that. That I was determined from then on to be a heart doctor, a heart surgeon, that is.
So that was also your dream, to become a heart doctor?
A total dream. I had a passion for it, and I never veered. I just continued like a blinded horse going along.
Okay, you started in your country, Egypt, and then you went to England. What was the first challenge you faced when you reached there?
That's a very good question, because when I left Egypt, I thought that I knew everything. When I arrived to the UK, I was challenged. And that was great for me, because I found out that I didn't know everything. I knew very little, and I had to study hard and to have to prove that I was any good at all. And that was great for me. So that was the first challenge.
How old were you there at that time?
I was 26.
26.
Yeah.
And the first achievement you were able to reach?
That I started to work for somebody I was targeting, Lord Brock.
Okay.
He was Sir Russell Brock at the time. I knew the name, and I became his first assistant. That, to me, was a great achievement. I had worked very, very hard to be able to be appointed as a senior registrar to his lordship, Lord Brock. He was Sir Russell Brock at the time.
Okay. Now, you told me that even though you've done these talks so many years, you still feel as if you're doing it for the first time. But I'm sure that, it might be the same when you do the operations as well. So what causes you sleepless nights? Do you sleep well before the operation? What do you do? What's the ritual?
Operations become more or less routine, but never routine, because they are different. Each one of them is different, and you have to tailor it to operation. But I have performed and, between inverted commas, invented new operations. That is when I do not sleep the night. I keep thinking about how it is going to be done, and I do it in my dreams, so-called, all night. And then when I go to the operating room, people say, have you done that before? It was so smooth. I said, in my sleep. And I worked out every step. And that is, but it cost me a sleepless night.
I can see that. Do you remember how many operations you were able to achieve?
I honestly cannot tell you, but I have performed in excess of 30,000 heart operation and 3,500 heart transplant or heart-lung transplantation. 30,000.
There's a special relationship that sometimes you build with your patient. Is there anything that you would like to share with us about this kind of relationship?
Yeah, I think I have always put two targets in my life. And I always said, and I do believe that I have only and only two masters who I look up to. Who are they? Patience and science, and nothing else. Everything else follows. And that is why in our center, all the scientists, we're very, very different groups, nurses, doctors, technicians. If you ask them, what are the most important things they will tell you, patience.
And science.
And science, discovery.
Okay, now, we know that you'll find a lot of people who are desperate to get the heart, and the donors are very few. when you have one heart and one donor, and you have many people who are in need, how do you decide this person will take the heart?
That question has been daunting to me throughout the period of our heart transplant program, which is continuous, by the way, at Harefield, the biggest heart and heart lung transplant in the world by far. But how do you allocate an organ? What is a question without an answer. And initially, people said, oh, but he's younger. Oh, but younger, there is a middle-aged person who's looking after 5 children. Who is important? He's brilliant. That doesn't come into it. Oh, he has committed a crime and he's in prison. Oh, I'm not a judge, excuse me. I am a doctor. I'm a very humble doctor as it comes. I'm not going to leave the judge deal with him. And as it happens, and so on. So what came to the rescue is we had a program of tissue typing. Mm-hmm. And I had dedicated young persons who slept with the database next to their bed. So I would ring at 3 a.m. because the donors usually come at 3 a.m. in the middle of the night after they are declared brain death at the end of the day. And I ring the tissue typer and say, what is the closest tissue typing this heart can do? And the next is size, of course. But then he says, he looks at his database and we get the best tissue type. Also, we had like 200 people on the waiting list, like you say. So that's how it worked.
Well, that's very, very critical. One of the questions that people sometimes ask, why did you choose Aswan as a center in Egypt? And why you would like to mirror it now in your second center, which is supposedly going to open next year? What's the link?
Aswan, there are more than one reason. But the main reason is it is a neglected area. And that was in the forefront of my mind, that people, children in particular, who came to Cairo when I was operating during a mission in Cairo, they arrive in a sorry state and said, that cannot be accepted. We have to have a center in Aswan. This is the main reason. But other reasons are, it's a beautiful place you have seen. There is a tradition along with the ancient Egyptians. They're almost looking at you. And the weather is super for recovery. But the main reason, of course, is the neglected society.
Desperate need there, yeah.
They needed a center rather than them traveling on the train 16 hours and the child arrived dying. That was totally unacceptable.
Yeah. Unfortunately, I only have 1 minute left. I have so many questions, but I'll ask you the last question. Can you give a tip? What's the best tip you can give it to the young doctors who are looking to become another Magdi Yacoub?
I think they can become much better than Magdi Yacoub because they can take from where I have ended. It's like what it said, standing on the shoulders of giants. So you keep going forward. The advices, I have the 3. You asked for 3?
Yes, sir.
The first is humility. If you think that you know it all and you're very important, you're dead. Humility. The second is persistence. I'm not a genius. I'm just persistent. I will never let go. Once I have a job, I have to finish. Don't veer. So that's the second advice. Work hard and persist, not to go from here. No, that is no good. And the third is passion. Love what you do. Be convinced that this is what I love. You know passion? So be passionate about what you do. So these are the three things.
Well, thank you very much. And I'm sure that the young doctors are going to learn from these tips. And I thank you very much for making the time and also talking to us so openly and freely. Thank you very much.
Thank you.
Thank you.